Hello again. This will be a very brief overview of the Lex Enterprises Incorporated website as of 2011, and it has a very informative video about hospital-acquired infections on the website, and we'll be reviewing those videos. And I just want to let you know that patients that are inviting and want to learn more, we will have the benefit of having the tablet with us is it allows us to come by with our iPad or Surface tablet and use the clean screen white. Clean off any fingerprints. So we basically come in the room, and that's what is so beneficial about the EMR. EMRs right now are not being used to show patients things online. Sometimes patients may not be familiar with how to Google something the right way. Maybe putting quotations around it kind of helps with the search results. So we can kind of give them a little small Google tutorial, or show them how to pull up a URL, and give them even a library resource where they can use the internet and things like that. Just kind of teaching people how to take the initiative that they need, especially when they don't feel so good. So I'll show you here. The technician would come by with the stylus and iPad, and there's already an app created right here. Not an app, it's actually a home screen button on the iPad. I hope to have an app. So go on ahead and pull up the website, and then we'd be able to show the patient in the room what we're about, and we would be in full control of the presentation, but they could learn about Lex Enterprises Incorporated, which is the corporation that the Health and Care Intelligence Agency derived from. So it even talks about Verify and the healthcare management. And the great thing about it is they can go on here and watch a video. So make sure the camera can see. We'll have the Wi-Fi integrated, and it'll start right there. So we can even begin the patient learning process in the hospital. So I'm going to go on ahead and dim the lights and play this video for you all. 5 minutes and get prepared for the video. All right. This is the website for Lex Enterprises Incorporated. And as you can see, using my laptop here to show you the website, and it's dedicated to preventing hospital-acquired infections, communicable disease transmission reduction, and hospital-acquired infection prevention is the best medicine. This is a home screen with the combating hospital-acquired infections video. Okay. Patient can scroll, they can even like it on Facebook. And basically it just talks about, we concentrate on basic microbiome principles, OSHA and HIPAA standards, and HAI, which stands for Healthcare-Associated Infections or Hospital-Acquired Infections, and Communicable Disease Transmission Prevention Practices. That's an overview, briefly. We're available for healthcare consultations, and we love feedback. You can read about Lex Enterprises Incorporated. You can contact us on the About Us page. We're truly committed to helping our clients achieve healthcare excellence. You can read about the healthcare management knowledge base and the Verify and Department Patient Equipment Usage Tracker. And as you can see there, iPads are already being used in the healthcare arena. This one is being used in an OR. Under the Consulting tab, we offer consulting on infection control practices, HIPAA compliance, and OSHA guidelines. And this goes into detail. HIPAA, I would say, is one of the most important things that represents the integrity of what the Healthcare Intelligence Agency wants to reciprocate. Hospital-acquired infection preventive solutions. If you click there, there's a flyer available for you. And you can bookmark this page. Okay. You can save this page as a PDF. So I'm going to just save it to my desktop here. And back to the website now. I hope you got a chance to read that information on there and see what our flyer is about. It's a printable flyer. And that's in the Consulting tab. Now we'll go to Resources. And this emphasizes the importance of Verify, which stands for E for Equipment, P for Patient, R for Room, A for Admission. We focus on equipment sterilization, patient needs, room servicing, and admission volume. It also goes through several things that we feel are innovative and that we're offering. I was the sole proprietor. However, I do have a team of individuals that have given me substantial feedback. So that's what I mean when I refer to we. We've got resources and guidelines, common healthcare definitions, an EDX, which is the Equipment Diagnosis Resource Guide, EPRA, Verified Sterilization Methods Guide, Aeration Period Monitoring, Disease Transmission Reduction Techniques, Improved Hand Hygiene Awareness for patients, staff, and visitors. That includes learning the difference about the gloves and allergies. Okay, so that has to do with the hands, so we can incorporate that with the Hand Hygiene Awareness Program. Improve Patient Care Methods, and the Nurses Station Recommended Protection Guidelines. And that one is really close to me because the nurses work so hard. I see them work hard. They're always at the patient's bedside, and you know they have to have time for their coffee and things like that. So that gives them the opportunity to have their nurses station cleaned at least like between every shift. If it needs more attention, then they can request that as well from the EPRA verified technicians. EVS simply can't get around the whole hospital. We need more team environment and more protection. So basically we're protecting lives in healthcare one day at a time, each method at a time. So the EPRA Verify Information Verify Guide is available if you email us, and the topics will include, like I said earlier, hospital-acquired infections, communicable diseases, pathogens, and chemical agents. We also have the products available, which include the common health care definitions, abbreviations, and diseases, common medical devices and associations, referring to like semi-critical, non-critical, and critical equipment. So an IV pump versus a pair of crutches, which one would you sterilize first? It depends on several factors. We go into those kind of details. Hospital-acquired infections guide with pathogen association and stereochemical recommendations. That was provided with the wonderful help of the CDC and FDA and EPA and other government collaborative agencies who put together a document with FDA recommended brands for chemicals, and I use what those brands treat specifically the pathogens that they treat, and I use that to relate it to the part of the body that is affected. So for pneumonia, that would be the throat. And then make sterile recommendations based on the type of equipment that it is. So we go further into detail. There are elaborate charts that explain this a little bit better than my brief overview. Then we have recommended chemical agents and effective sterilization techniques. And that's one of the last of the resources that we offer. And it provides chemical abbreviations, effective concentration levels that the EPA and FDA have approved for brand names and also the generic brands. And the EPRA verified specialized sterile techniques. So there's a prior video recorded at an earlier date that goes over the specifics of our sterilization techniques in comparison to others that are out there right now. Under our news section, it's meant to take away some of the anxiety about hospitals and let the people know that we haven't forgot about the fact that they may feel that hospitals are dirty and that we're doing everything we can to change that perspective. Everybody has an opportunity to grow, change, become a new person, and develop new initiatives, develop new projects. This world is all about expansion, growth, and rapid technology and changes. So we acknowledge that with Lex Enterprises Incorporated, and this EPRA Verify Information Guide gives patients back that confidence and that trust in hospitals. It's a total of 6 pages, and it's downloadable in a PDF format. You just have to contact us for it. And lastly, we have the Contact Lex Enterprises, Lex Enterprises Incorporated page. And I just want to encourage you to contact us with any feedback, whether it be negative or positive, or any general questions, and we'll do our best to get back to you and answer your questions. So now we're going to watch the video on hospital-acquired infections that I personally have selected for my webpage. I hope you got to see the visual representation that video represents. Now we're going to watch the video in full volume. I just hope you got a chance to see the expressions, the environment, just get a feel for it without all the sound being so loud. So now we're going to watch the video with all the sound and hear what they have to say. Sometimes you have to see things and see people's actions and expressions to understand what they're trying to say, or see the compassion in their eyes. And then when we hear what they have to say, we can make a better judgment. But I wanted to do it in reverse. I wanted to pay attention to body language first, and initiatives, and environment, and situations. And see if you pinpoint some things that you could improve in that situation. Now listen to the volume. Listen to it with volume, and hear the explanations that are provided, the methods that are being taught, and the things that are being put forth. So, your first impression should always be off the body language of the individual, and then listen to the words that are coming out of their mouth. Okay?
In the region's busiest emergency room, 3 out of 4 people who are admitted to...
We're going to start that from the top.
At Grossmont Hospital in La Mesa, the fight to reduce hospital-related infections starts here, in the region's busiest emergency room. 3 out of 4 people who are admitted to Grossmont come in through the ER. They're usually the sickest patients, and the ones who are the most vulnerable to infection. That's why the ER is ground zero in Grossmont's fight to battle sepsis. Sepsis is a life-threatening condition that occurs when bacteria overwhelm the body's immune system. ER Dr. Julie Phillips says septic patients are in danger.
They need aggressive therapy, they need it quickly, they need it initiated immediately when they come into the ER, and those are the patients that we're trying to pick up as quickly as possible when they arrive here. Having heart problems, the heart rate is really high.
The identification of sepsis begins when a triage nurse assesses the patient. The diagnosis is made inside the ER at the patient's bedside. Thanks to a high-tech device, doctors don't have to send blood samples up to the lab and wait for results.
For this particular machine, the turnaround time is a minute because it's here at the bedside, and so what happens is if I get a septic patient who comes in, I suspect sepsis, but
Alright. While the video is buffering, think about how you feel right now. I was talking about the complete blood cell count earlier, and as you can see, they're able to get lab results on septic patients, basically probably ordered stacked. So, I am not a physician, so I do not know, or a phlebotomist, or a lab technologist. So I do not know all of the fastest ways to get lab results. However, from this video, it appears that upon admission, we can do lab results. So I think we should integrate the OraQuick HIV exam and a micro blood panel with a Lancet fingerprint. And we'll continue watching the video. This is an excellent video, by the way. I feel that it's very informative. I'm sure there are more updated videos. However, this is a video that I've chosen for my presentation as of August 14th, 2014 to August 15th, 2014. So, I'm sure you've had a little bit of time to analyze the tray and research the word septic. Notice her white coat or full uniform, and just take a look at the environment. You see the nurse's station in the background. You've got the fire extinguisher because things catch on fire. You can see where I was inspired to come up with the ideas that I came up with. As you can see, she's using a cart. Those carts, remember I said the handle with the tablet holder on one end and the handle grabber on the other, so you can push the cart, hold the tablet, and read it with both hands at the same time. Just to give you a little taste of the true innovation in Lexington Project Incorporated. You know, everybody sees things differently and has different perspectives in life. And if we were all the same and all saw things the same way, we'd all be robots. But we're human. So that's why it's important to collaborate. And see, she's got her pen ready, and she's got 2 pockets, personal items, and she's getting ready to take care of some patients. So if you come into the hospital septic, they will treat you. And that means that you have an infection present in your body. So they want to get rid of that infection. I focus a lot on wanting to implement the HIV check because people don't take the initiative to get tested for different reasons. And some people don't have the energy or the money or the resources to do that. So the admission to the hospital is a prime example for an open opportunity to check for those things for people. Looking out for the patient, okay? Because people can still live with those things if you catch it early enough. Same as with cancer. So, however, there is no cure for those items, for those, illnesses. So, just think about what you see. Just think about what I've talked about in my videos, and just take some time. The website is LexEnterprises.com. All one word. LexEnterprises.com. Yeah. And if you have any feedback, or you have another video that you'd like me to post on my website, or you have questions, concerns, comments, negative or positive feedback, constructive criticism, anything you want to offer me, feel free to email me at lexenterprises.inc@gmail.com. I love to hear from people and hear their stories and do my best to answer their questions. So, for the rest of this video, visit my website, lexenterprisesinc.com. And that concludes this video session. Thank you. Once again, my name is Alexandra Burrows.